Hey teams, Lauren here with Bizrok. In today's video, we're going to talk about a concept called matching and mirroring. Now, I can't take credit for this incredible communication technique, but so I will give credit to where it's due. It's Dr. Milton Erickson. See, he was like the godfather of psychology. People would go to him, patients would go see him if they couldn't get fixed by another psychologist. And Dr. Erickson was just brilliant at being able to communicate and connect with his patients. Nobody could do it like him. Well, what they found was he used this technique called matching and mirroring. Now, if you've never heard of this before, matching and mirroring is finding small, subtle things that your patients are doing them and meeting them where they are. You know, if you've seen any videos with us in the past, you know, we've talked about whenever a patient walks in and you're greeting them for the first time. Most of us are sitting back down in the chair, and so whenever they come in, they're coming from afar and they're looking down on us. Well, if you want to truly connect with your patient, you want to meet them where they are. You want to use that matching and mirroring technique, which means you stand up out of your chair so that you are eye level with your patient. That's matching them. That's mirroring exactly how their body rapport and body language is. So it starts to build some subtle connections. Maybe you're a clinician and you're like, okay, Lauren, well, how do I match and mirror my patients? Well, if you're speaking to your patients about treatment or even getting to know them, one of the most important things that you should be doing to match and mirror them, but also to make them feel comfortable and connected to you, is to sit down. You know, you bring your patient to the operatory and you point to the chair, and so they're sitting down on this chair, which is already a very vulnerable position, and instead of standing to ask them questions, you want to meet them where they are, which is sitting down in your chair, so that you're eye level with your patient. That's matching them. Now, there's other small subtleties that you can do when it comes to matching and mirroring. If you have maybe a fast talker patient who speaks really, really fast and they've got this tempo that's really, really quick, you can match and mirror them that way and speak at a quick speed. Maybe they're in a hurry. Maybe they're from up north. You know, some of our northern clients, they speak really fast versus our southern clients, you know, they take it down a little slower. And so you can match and mirror your patients in that manner. Again, it's about your patients feeling comfortable and connected to you. So matching and mirroring is just a simple, subtle way of doing that. There's also some small, subtle things that you can do if you have a patient in the chair. Maybe you're in the treatment room and you're trying to connect with them and trying to talk to them about their treatment and the finances that go around their investment. And so you're talking about, here's the type of investment that we're looking to do for you, and you're just not connecting with them. Match them in their volume. Match them in their tempo and pace of how they're speaking. But you can also have small subtleties, like if for example, if the patient's legs are crossed, maybe you can cross your leg over. Now, hear what I say. That doesn't mean if they touch their face, you touch yours. If they sneeze, you sneeze. If they cross, you cross. Like, guys, come on. You got to use a little bit of emotional intelligence on this one. But doing small, subtle things to connect with your patient, they'll walk away saying, wow, this is really special. Like, I really feel like I connected to this person. I feel like they heard me. Now, in trainings, we always have the question, there's always at least one team member who will ask, they'll say, all right, Lauren, if a patient comes to me and they have an attitude, should I match them in their attitude? Guys, that's a big fat no. Please don't do that. You know, use a little bit of emotional intelligence on this, guys. But if somebody has an attitude, if you speak slower and you speak calmer, you can actually bring that patient's rapport and tempo down so that they start building that connection with you. When used correctly, it's really, really powerful. And again, it's all about connecting with your patients. It's all about making sure that your patients feel like you are the right person for them to speak to. They feel like there's a level of trust. And most importantly, that they leave feeling like they were taken care of and served. So here's my challenge to you. It might be tough for you to do the first few times, or maybe you're feeling awkward about trying matching and mirroring with your patients. Instead, don't use it on your patients. The next time you're in a restaurant or out in public, find somebody across the way and try to match them and mirror them in small, subtle ways. And then as you build confidence, as you try it a few times, try it on your fellow team members over lunch. Don't tell them what you're doing. Don't give them a heads up. Just simply practice on them, and that will make you feel more comfortable and confident when you're communicating and sitting across from your patients. So give it a try, and if you need any help, if you're getting stuck and saying, gosh, I don't know, am I doing this right? I might need some guidance, or I've tried this and this happened. Like, guys, reach out to us. We love what we do. We love helping our teams. We love helping our practices. So reach out to us. And if you're not a client, go to www.bizrok.com. Share with us your story, and we'd love to help you and serve you and see you soon. Thanks.